Hey kids, so we've talked in our vital signs lecture about taking an apical pulse, and so you know that the apical pulse is actually taken at the apex of the heart, which is the very bottom part of the heart. There's certain landmarks that you have to look for. It's the fifth intercostal space, mid-clavicular line. So you're going to find that first intercostal space on your patient, kind of feel your way down to the fifth intercostal space, and then mid-clavicular line. So for your females, you're going to have to get up close and personal because you're going to be right up under that breast tissue, and you may even have to ask the patient to move that a little bit, either lift it up or to the side. And it might be a good idea, since you're going to be in their bubble, to make sure you have deodorant and Tic Tacs too. Okay, so I'm going to explain a good bit while I'm doing this, and then we'll go back and do it in real time so you can see how long the procedure is going to take and how it should work when you're doing your validations, okay? So I've got my equipment, which is a stethoscope. We're going to go in, knock, come in, do all your pre-procedure and post-procedure. Hey, Miss Langston, how are you doing?
I'm good. How are you?
I'm good. Give me some hand gel. You know, some patients think this is lotion that everybody's putting on when they come in. Isn't that crazy? Okay, well, my name's Lynn. I'm from Hartsville High School, and I'm just going to check your pulse. I'm going to listen to your heart and count your heartbeat, okay?
Okay.
Can you tell me your name and birthday?
2/22/71, Jan Langston.
Perfect. Okay, so I'm going to actually go to the other side of the bed because that's going to give me better access. And then I'm going to raise you up a bit. Lower the side rail. Okay, so we've talked about a stethoscope in the classroom, but these are your earpieces. You can see they're kind of angled. You want this to be pointing towards your nose. Now, we've probably done this in class, but just as a refresher. So when you put it in, you want it to be pointing towards your nose. And remember, this is the bell side, this is the diaphragm side. You want to check the apical pulse with the diaphragm. So once you put your earpieces in, you're going to twist this around and tap to make sure you're on the right side, okay? So let's go ahead and find her fifth intercostal space. Now again, you're going to be up close and personal with your patient, and we're just going to, when we pair up for this, girls are going to be with girls and guys are going to be with guys, okay? Because I don't need any parent phone calls. So we're going to go down, fifth intercostal space. Okay, I'm going to get you to kind of lift up because I don't want to do that. We're going to, I don't want to be, accused of sexual harassment. All right, I'm checking my diaphragm, and it is activated, mid-clavicular line, and you're going to put it right here. Now look, give this a second for your ears to adjust and for your ears to capture that beat. What a lot of kids want to do is they put it here, don't hear anything, I don't hear anything, I don't hear anything. You gotta just calm down and let your ears and brain capture that sound. You should be able to hear the lub-dub, lub-dub, lub-dub. That's one beat, okay? So you count the lub-dub as one. So you're gonna count this, if you were in a hospital setting, you would count this for a full minute. Remember, you're doing this because of some reason we'll go over in a minute, but you're going to count this for 1 full minute. Now when we do our validations, I will probably ask you to count for 30 seconds because just as a time-saving mechanism, but you're going to count in the real world for at least a minute, okay? So pull back, take that off, and on your skill sheet you'll notice that there's some things you're going to have to verbalize to your instructor. It's always marked with a little asterisk. So we're going to ask you, when do you have to take an apical pulse? And there are 5 times. Infants, children, if a patient has an irregular peripheral pulse, remember peripheral is like your radial pulse. It's on the periphery of the patient. This is central, so you're taking a central heart rate here. So irregular peripheral pulse, patients with heart murmurs, and patients on certain cardiac medications like Lanoxin or Digoxin. So you're going to have to verbalize that to your instructor. So when we do this check-off, I'm going to be listening with the teaching stethoscope. I'm going to walk away even though my side rail's up, so I'm going to grab my stethoscope. Don't ever do that in real life. Make sure your side rail's up. So when you validate for this, look at this cool thing. You're going to have in your ears, and I'm going to have it in my ears, and we're going to have it on the patient, and you're going to count for 30 seconds, and when you get your value, you're going to tell me what it is per minute. So whatever you get, you're going to multiply it times 2, and then what I've counted has to be plus or minus 2 of what you got to be considered checked off, okay? That's gonna be the way it is with all of our manual vital signs. So anyway, I've taken that, let's see where I am in the process. Post-procedure guidelines. So we're good, we got our pulse. Lower the bed. Are you comfortable?
I think I want to sit up a little.
Sit up a little bit. You know how to adjust? Do you know how to use the call bell?
Yes,
Let
I
somebody
do.
know you did something?
Thank you.
All right, you're welcome. So now I'm gonna run through this. I'll grab hand gel, it's on the other side. I'm gonna run through this in real time so that you can see what it would look like when you do your validations, but I'm still gonna use this stethoscope. All right. Knock, knock.
Come in.
Hey, Miss Langston, how are you doing?
I'm good. How are you?
I'm good. My name's Lynn. I'm from Hartsville High School, and I'm gonna listen to your heart, count your heartbeat, okay?
Okay.
What's your name and birthday, please?
Jan Langston 2/22/71.
Perfect. Okay, I'm gonna actually come to the other side of the bed. Your heart's over here. I'm gonna raise it up just a little bit so I don't have to bend over. All right, now I'm gonna put my hands on you for a second, okay?
Okay.
Just kind of assess where I need to be. Okay, right there. Could you like put your hand in, like assist me? All right. Okay, so for 30 seconds, I got 28, so that's gonna be 56. Have to do that mental math. Okay, get that side rail up. Lower the bed. Do you know how to work the call bell?
Yes.
Are you comfortable?
I am.
All right, awesome. You let us know if you need anything, and somebody will be here to check on you in a little while, okay?
Okay.
All right, let me grab some hand gel.
Do you know when my COVID results are coming back?
Oh my gosh, your COVID test. Let me talk to your doctor.
Okay.
It should be back. Let me talk to your doctor. And if that's the case, I need to be wearing a mask. Ah! Okay, kids. So that's Apical Pulse. If you have any questions, let your instructor know. We'll be happy to answer anything you might want to know.